Heidi-ho, everyone! I'm assuming since you're watching this video that you're going to be writing your second paper as an informative paper about an illness. There are a couple of different ways that you can organize this paper. It kind of depends on what you decide to focus on in your paper. So let's quickly go through and discuss those. As I said, the organization can vary depending on the focus that your research leads you to. Some papers might discuss only the cause of an illness. Frequently, those papers result from research that leads to either the notion that the cause is very complex or that the cause is unknown, as we will be discussing in a few moments. Some papers might discuss only the symptoms, and again, we'll discuss situations that might lead to those kinds of papers and how to organize them in just a few moments. And some might discuss only treatments, which we will discuss in a little more depth very shortly. But most of papers will discuss all three. Particularly papers that are addressed to the nursing field or some other direct patient care area or discipline often discuss the causes, symptoms, and treatments of an illness. Nursing students find these papers very good to write because it helps prepare them for what they're going to be writing for their future courses. Okay, first let's discuss papers that will present information on only the causes. Sometimes these papers discuss a single complex cause in depth, and generally that uses a chronological order. For example, many mental illnesses, bipolar disorder, for example, are believed to be caused by a really complex interaction in the synapses of the brain. Certainly, a paper could discuss how the chemicals in the synapses of the brain cause problems in neurons transferring positive emotions from one neuron to another. That's a very complex kind of a cause, and it could easily take up a full 5 to 7 page paper to discuss that cause. In that case, the way that the cause works is definitely chronological. There's a stimulus. The stimulus leads to an impulse in the brain moves through a neuron. The neuron then attempts to cross the synapse, and so forth. So there's a chronological order that's often used in cases like that. But another way that these papers might be approached, if the research leads you to focus on it in this fashion, is to discuss competing theories of cause. For example, no one really knows for sure what causes cancer. You might do research and discover that there are competing theories as to what causes cancer. In a case like that, you would use emphatic order. Usually you would discuss the cause that has the least data supporting it first, and the cause that has the most data supporting it last. Pardon me. So if you are discussing only causes, depending on which of these two situations you're running into, you should view the video on chronological order or emphatic order. Okay, now you might write a paper that discusses only the symptoms. Often, these papers discuss symptoms that appear in a particular sequence. In that case, again, you would use chronological order. What symptom appears first? What symptom appears second? What symptom appears third? If you are writing a paper along those lines, you'll definitely want to view the video on chronological order. On the other hand, some papers might discuss symptoms in terms of either their severity or how easily they're observed. And in that case, you would use emphatic order, with the least severe being discussed first and the most severe being discussed last, or the least observable being discussed first and the most observable being discussed last. And in that case, you would want to view the video on using emphatic order. And finally, some papers will discuss only treatments. Again, some papers will discuss a series of treatments that are used or at least attempted in sequence. Again, to use mental illness or depression in particular as an example, frequently the psychiatric community attempts first to work to treat depression through what's known as cognitive therapy or talk therapy. If that doesn't work, they generally move on to medications or a combination of medication. If those don't work, then sometimes they move on to ECT or electroshock therapy. Those are done in sequence, so you generally would discuss those in a chronological order. And there are other illnesses that follow the same type of a sequence. And if your research leads you to write a paper along those lines, you will definitely want to view the video on using chronological order. However, your research might lead you to write a paper that discusses competing theories of treatments or different treatments that are used. Often, one of those treatments is preferable over others. And again, you generally use emphatic order for that, with the one that is the least treatable, the least preferable discussed first, and the one that is the most preferable discussed last. And if you are writing a paper along those lines, you'll want to watch the video on using emphatic order. But we need to discuss papers that discuss all three of those aspects: the causes, the symptoms, and the treatment. Because that will be the most common paper, the most common type of paper, and the most common organizational scheme that a paper on an illness would lead to. First of all, you open with one of the 6 methods of introduction that are outlined on the Introduction and Conclusions handout. Certainly you could start with a story, either real or fictional, of a person who is suffering from a particular illness. That could be a good way to open your paper. But as always, a broad statement introduction, such as the one we used for paper 1, is also perfectly acceptable. A broad statement introduction is never incorrect in an informative academic paper. So it's good to know how to use those. In some disciplines, particularly in the social sciences and the hard sciences, broad statement introductions are preferred. It's mainly in the humanities where the variety of introductions is seen most often. But for our class, any of those would be fine. At the introduction, you will have a claim with a plan of development. Now, for an illness, frankly, the claim is almost always the same no matter what the illness is. It starts out with naming the illness, which of course is the topic of the paper. So let's say you're writing about diabetes, type 2 diabetes. Your claim would be type 2 diabetes is characterized by specific causes, symptoms, and treatments. You would have exactly the same thing. You might have uterine cancer is characterized by specific causes, symptoms and treatments. Pretty much you're going to have the same claim no matter what illness you're writing about, and that's as specific as your claim needs to be. Now, your introduction might be followed by background. You have to judge for yourself whether your audience is going to need this background or not. In some cases, you might think that the history of an illness or the history of how we learned about an illness might be important. You might find that you need to define some terms, and you might believe that it's better to put all those definitions in one place. And if so, then you might want to include a background section. This is very similar to the decision that you made as to whether you needed a background section on paper 1, right? Not much different. Okay. After you finish the introduction and the optional background, if you feel one is needed, then you discuss the cause or the causes. If you talk about more than one cause, you use emphatic order for that section only in most cases. After the causes, you discuss the symptoms. And the section on symptoms is usually in emphatic order, particularly if the symptoms appear sequentially. But you kind of have to use the same guidelines that you would if you were writing about only symptoms. If it's a matter of severity or observability, then you might have an emphatic section on symptoms. But most often, the section on symptoms is chronological, meaning that you discuss the first one that appears first and the last one that appears last. And then finally, you discuss treatment. And the section on treatment could be chronological or emphatic, as we discussed when we talked about how to organize a paper that discusses only treatments. If the treatment tends to be, for some illnesses, there's just one treatment. Okay? They give you a pill. For some illnesses, there might be a sequence of treatments that are attempted, and for some illnesses, there might be disagreement on which treatment is best. If it's a sequence, you use chronological. If there's a disagreement over which is best, you use emphatic. If you're only discussing one form of treatment, well, you just discuss that form of treatment. But these three sections might be organized differently. You might have a section on causes that's emphatic, a section on symptoms that's chronological, and a symptoms on treatment that is just discussing one treatment and is neither chronological nor emphatic. That's perfectly fine. And overall, your paper will not necessarily be emphatic. Now, that's something to keep in mind because I emphasized using emphatic order in paper 1 because of the type of paper it was. But this type of paper is not necessarily going to be an emphatic order. If what needs to be discussed based on the data that you find is the treatment, then yes, the section on the treatment will be the longest. But if what you find the most data on that needs to be discussed the most is symptoms, then the section on symptoms is going to be longer than the section on treatment. So the paper will not necessarily be emphatic. Don't force it to be emphatic. This is very much a paper that is going to be organized based on your research. It's data-driven organization. I can't be really specific about what your particular paper how your particular paper needs to be organized because it depends to a large degree on what you uncover in your research. But of course, you can always email me and ask me, right? You know that. I'm always here to answer questions for you. And I also do encourage you to send me drafts of the paper. Of course, you don't want to wait too late to send me drafts because if I get too many during the last week, I can't possibly read all of them, right? Okay, so I hope that this little video helps you to understand how to organize your paper. If you have any questions, of course, don't hesitate 1 minute to email me. And you send emails to deborah.oakey@csn.edu. And of course, we know that you have to email me from an account other than Canvas, right? Yeah, you've only heard that 100 times this semester already. Okay, well, thank you very much for listening to this short video. I hope it helps you. If you do need to use either chronological or emphatic order for your paper, make sure that you view the brief videos that cover chronological or emphatic order. And of course, don't hesitate to contact me if you have questions. You have a great day, and I hope you have a little time to enjoy yourself today.